All right, welcome back to Resilient Voices and Beyond. I just want to take a moment to thank you all that are listening. Thank you all for the support. Thank you all for your kind words and just following not only this podcast, but the initiative behind Resilient Voices and Beyond, joining um, the coffee and conversations I've been having and following the other support and uplifting other alumni and other people who are doing great work on my social media. So I can't thank you guys enough. You guys are active and you guys are involved and I really appreciate it. And would not be here without you all. I actually looked up where I'm at, so I'm not confused this time. So y'all gonna be proud of me. We are at episode 10. I had to figure some things out, but my numbers got messed up, in my head. But we're at episode 10, so I'm really excited about this episode today. We have a great young man um, on today, and he's going to share some of his wisdom and knowledge and expertise with us. But I could talk all day and talk him up about some of the great things he's been doing, within his years. But I'm gonna have him introduce himself.
All right. Thanks, Michael. It's great to be here. I'm on the other side of the lake from you, or beaming in from Wisconsin today. So my name is Chuck Price. I'm right now the co-owner and consultant with Blue Collar Consulting. And so our whole business is around consulting with human service organizations and really across industries and sectors. And our whole vision is to bring humanness back into the workplace or into the workplace. We do that through a trauma-informed lens and trauma-informed approach. And I do that based on years of experience in human services and the child welfare kind of circles. And so my career spans about 29 years, going back and working in the Milwaukee area in child welfare with at the time it was called the Bureau of Milwaukee Child Welfare, and have kind of made my way to central Wisconsin, where I've been a child welfare supervisor or child protection services supervisor here in the county that I live in Wood County. I was the deputy director there for a time. I've been a director of health and human services in 2 counties here in Wisconsin, in Adams County and Waupaca County, respectively. And then I was also the president of the Wisconsin County Human Services Association for a little over 2 years during my time as director with Waupaca. So majority of the work that I do is really all based on that whole career that I've had within child welfare, human services, and especially over the last 8 years being a director in Waupaca County, and just some of the work that we're doing around trauma-informed implementation.
Awesome. Well, as I said, you guys, like a wealth of knowledge. But we're gonna navigate, through some of those experiences and to the work that you do now. So my first initial question to get this conversation started is, where did this all begin for you? And if you could walk me through if there was any barriers or obstacles that you had to overcome, throughout navigating to what you do now.
Sure. So it's been an interesting path. And so, coming out of college and things like that, I really didn't know what I was going to be doing. And so child welfare was not in my purview. I wanted to work with kids or families. I knew that, but it wasn't through what in my brain, it wasn't going to be through child welfare. That wasn't a system that I was really interested in at the time. And I just think, if maybe it was Steve Jobs, I think had said, like, you don't start to figure out what you're trying to do now, just kind of, you'll figure it out when you look back and connect the dots. And so when I look back, you see kind of like the universe playing a role all the way through. And so, like, when you think you have control of where you're going and what you're doing, you can kind of just sit back and laugh sometimes and go, I'm really not in control. I think there's a higher power that sends you in different directions. And so I started out just early on in my career in a residential treatment center with being a social worker there. And it just didn't feel quite right for me. And then ended up in a program called Wraparound Milwaukee. And so a lot of coordinated services and things like that. And that really kind of set my foundation of what I think, or how I thought the work should be done. It was like, setting up teams and informal supports around families and making sure that um, children weren't going into residential, and if they were going to residential treatment, that they weren't going very long. And so we would, you know, go to those first intake meetings and start talking about discharge plans right away. And so you can't do that kind of thing without building up supports around the family, building up supports with community services and things like that. And so really early on in my career, I had this exposure to like how systems should really operate together to benefit supporting families so that families don't have to come into the system. And then I kind of went into child welfare with the Bureau of Milwaukee Child Welfare early on. There was some uh, openings, and I ended up at the hotline number in Milwaukee. And so it was 220 SAFE. And so I was taking the calls of folks calling in with alleged child abuse reports. And so that's where I really kind of learned about child welfare, learned about those types of reports and things like that. And as I'm gathering up those reports and taking all the information, I would hand those off to a supervisor who would send that out for assignment and things like that. And so that's really where I got introduced. And it just seemed like this huge bureaucracy, and you never knew quite what happened if you did those reports, like where'd they go, what happened to those families and things like that. And then when I became an ongoing supervisor within that system, so working with families that were involved in the court system with their children placed outside of their home. And so as a supervisor within this larger system, really felt like you were kind of trapped in this bigger bureaucracy. And so by the time things got to me as a supervisor from like wherever it was coming from at the time administratively, you just felt like you're more of like a messenger to your staff. And so I think the barriers for me at that point was like, it just felt like just a little bit of a hamster wheel type of feel. You're just always going and always kind of in crisis mode and things along those lines. And where did I get to have either a say or how can I help the system? It just felt like I really needed to concentrate on my people, my staff that I was supervising. And so I think that's where I really started to see the impact that leadership can have in an organization. And so my role was as supervisor and ongoing. And so I had the opportunity and the responsibility to support my staff who were in their ongoing roles, the ones that were doing direct service with families. And I could see early on, like if they were stressed and out of control or dysregulated, my staff, their outcomes, the way that they're serving children and families was going to be impacted, and typically negatively. And if we had staff that were doing okay and healthy, then those outcomes for the children and families they were serving were better. And so I started to see that early on. And I think that really helped shape my career. And so there was like barriers in terms of like bureaucracy and all these other things. And so we had practice sides of things. And then there's this other side of like, making sure reports are done on time and getting things, like the checkbox types of things that you needed to kind of project manage. And those were the things that were like, those were a little, that's not where I wanted to be spending all of my time. I wanted to be spending my time in the practice side and making sure that our folks were getting what they needed so that the families we were serving were getting what they needed. And so as I continued to progress in my leadership roles and made the move here to central Wisconsin as a supervisor and then deputy director over the organization. And then as I've become had become directors in the health and human services world, I always think I had this kind of driving thought in my mind was like taking care of my people or taking care of the people that were in my responsibility. So my staff that I supervised, or as I, went up within the organization, making sure that our staff were taken care of, that they were able to be healthy and well in their positions so that they can keep coming back to the work. And I think I intuitively was doing that, but as I kind of came along in my leadership roles, and then especially once I got introduced to trauma-informed care, really put on a different type of lens of like, we really need to take care of our people because of the things that they're bringing to the table, so that they can bring hope to the work every day for the folks that they're serving.
Definitely, definitely. You dropped like a lot, in that bit of time, and I'm just, recalling and reflecting on the many different positions that you were in to, be impactful and to impact not only your staff, but by impacting your staff, impacting the community, and it kind of just trickles down, but
Right.
also here, as a person that was in this position, you also felt that just a hamster in that wheel, and it's just turning, and I can understand, and you correct me if I'm wrong, how that can it you want to make the most an active change in what you're seeing, but also seeing that change is not really happening, and
Yeah.
and being in that place of limbo, especially being a director or a supervisor, and trying to push that positivity onto the staff and helping them, like, hey, I know it's definitely great, but
Yeah.
let's keep it going, let's keep, so um I want to take a moment to speak about that for those young social workers, and for those people that are in that field right now, or getting into that, and or in that space where they just like, dang, like, I have just 5 cases that just ain't going great right now.
Yeah.
How did you maintain mental health, self-care, and and I'm pretty sure at some efforts there was some secondary trauma, passed on to you, so
Sure.
how did you manage, and what advice would you give to those individuals in that space?
Well, those are all great questions, Michael. And I think um, leaders especially need to role model some of these pieces, especially around self-care, self-compassion, wellness, and things along those lines, because it can creep up on the best of us, and it can impact the work that we're doing, can impact our influence on our organizations, both negatively and positively. And if we're taking care of ourselves and role modeling that, that will have an impact on the organization. If we're not taking care of ourselves and not well, that also has an impact on our organization. And so I think we have to be really intentional. We have to be really self-aware. We talk a bit about building up those supports around you. Who's your inner circle? Who are your people that can hold you accountable to some of those things, and not from a finger pointing thing, but really from like, are you okay? And it's the one that can like support you through all the good stuff, and then kind of call your BS sometimes when you're not doing what you said you're going to be doing. And so you need some of those folks to kind of uh, help be your guide along the way. And so are there coaches, mentors, friends, families that can help you through those self-care pieces? Because the leaders within an organization are really the barometers, the thermometer for your organization, and needing to be that calm in the storm type of thing. And so if we're not able to kind of keep ourselves regulated and calm through some of these ebbs and flows of the hard times that come through, or the issues, cases, things like that, if we match kind of the dysregulation that might be coming through the door, then the whole agency is spinning. And I think you've probably been in arenas and organizations and things like that where you walk through the door and you're like, ooh, this is like a lot going on here, and a lot of people running around and ripping and running and things like that. And it feels a little chaotic. And in those types of situations, the same thing that we talk about with individuals, like when we're dysregulated, we can't think straight, right? We can't think rationally. We don't, creativity and innovation is out the door because we just can't get there. And so we go to what's safe, we go to what we know. And even if the outcomes and things like that aren't going to be good, the brain doesn't care, it just wants to be safe. And so if we can get ourselves over into a regulated way of thinking, so that our brain is regulated, or the organization's brain is regulated, then we have time to think. We can think rationally, we can think creatively and innovatively. And I think leaders have a responsibility, or can can really set the tone. We can be intentional about setting the pace, setting the rhythm for the organization so that we can talk about like not everything's a crisis that comes through the door. Because I think we can get into this flow of everything's a crisis. And now we're back into this dysregulations that we can get to a spot where leadership, leaders, folks in the organization are like at a calm state, a regulated state of mind where like things come through like, well, let's just take a minute to think about that, and think creatively and innovatively. What if we did things differently this time around with this person, this family, this situation? And so I think it's the leadership, myself included as the director, to kind of set that tone, set that intentional rhythm and predictability within an organization.
Definitely, definitely. And a couple things that you said that, spoke out to me is really, just setting that tone and that pace. I think about, my background, and experience being a first responder, and having to take high crisis situation because, in social work and child welfare, especially in a removal case or what have you, when in residential, all these, there's a crisis at the rise in that moment.
Right.
But in order to be able to triage, in order to treat, what's happening, you have to slow that pace down. That doesn't mean that the crisis isn't, really happening and it's impactful in that moment, but you have to be able to slow things down to make sure that you're doing things accurately, and really be able to triage. And I think about, some of y'all gonna get on me about this, but I think about basketball. When you gotta slow that pace down, because if you
Yeah.
keep the other team pace, you're gonna lose, you have to
Right.
slow it down, and that doesn't mean that you're like you in a 75 going 45. That just means that you take a little bit, get your mental together to be able to do the best that you can,
Yes.
in that circumstance. And that is a life skill. That is an ability that has to be learned,
Yes.
and it is on our organizations, our leaders, or our legislators, and all these people, that are orchestrated over, or supervising and managing to really, relay that and role model that and teach that life skill, especially in the workforce. We can't automatically assume, which I feel like happens a lot,
Yeesh.
that everyone knows how to set their own pace when it comes to caseloads, to when it comes to, being efficient and stuff like that, so we have to be able to take that time to invest in each and every one of our people that are working under us, but also invest in the people in general when it comes to child welfare. Because social work lately, I've seen a huge turnover,
Yeah.
and I feel like there's multiple reasons for that turnover, but also burnout is a big piece, and burnout comes from not really taking care of self, some other things that may be attributed to the job or the organization that you're working with, but also not having, a big piece. I feel like it's not having the proper tools on your belt when
Mhm.
taking on the job, you know, and you want to go into this in any aspect of child welfare, whether it's residential social work, whether it's, school social work, whether it's, being, a therapist, what have you, all these different avenues. You have to be able to slow things down. But also another thing that you spoke about is the importance of having individual self-care plans, but also having a plan with your circle.
Mhm.
This is something that when I do panels with our incoming social work through Michigan Youth Opportunity Initiative. And probably like once every couple of months, I go and speak to a group of 70 to 30 individuals who are getting, licensed through the state to go out there and be private agency workers, CPS workers, foster care workers, and then some. And one of the biggest things that I tell them is that you can't do anything for me or anyone else that you're working for if you're not taking care of yourself.
Yep.
Because by the time you get to me, if you haven't taken care of yourself, I'm getting the aftermath or the little bit of doses that you have, and that's not you being present with me. That's not you really receiving what I have, or you doing the best that you can. You know, um,
Right.
and I think that's really important that highlighting that this field in all aspects of it, you know, can almost be very selfless, you know,
Yeah,
but in some aspects, in order to do it, you have to be selfish, you know, and take care of yourself first, and and I can't speak to that enough. That taking time to debrief after your days, taking time to make sure you're straight, and then involving your community to continue on with that, mindfulness and self-care, and really working through those things, and having boundaries, and
yeah,
taking breaks in between. um
yeah, yeah. I think self-care, wellness, self-compassion, all those things. That we have to get out of the mindset that it's selfish, and know that it's okay to take care of ourselves. We need to be able to bring our best self to the work, because the folks that need us the most need us to be at our best. And so we talked about this quite a bit. When I was director of the last county that I was in, and I was there for like 8 years. When I started, we looked real close at like burnout, secondary trauma, compassion, satisfaction. And when we looked at the first time, when we just started doing trauma informed care, we looked at it. We had the front end staff who were doing the child welfare work, the child protection work. They were self-reporting, 90% burnout, 90% trauma, or 90% secondary trauma, less than 10% compassion satisfaction. And so here's folks that are essentially telling us that they don't have hope themselves, and they're supposed to be bringing the hope to the
mm,
people that we're serving. And it was just like this really huge moment where you're like, whoa, we've really got to do something here. And so when you flip the switch and start talking about bringing the humanness into the work and bringing the human back into human services, and you layer on this trauma informed approach of like, the what happened to you versus what's wrong with you. And so looking at that, taking a look at our staff then a little bit closer, and then we layer on some of the ACE studies. And so if you look at the adverse childhood experiences, had our staff kind of do their own scaling of that. And then anonymously, we put the results together. What we saw is like 32 or 33% of our staff, which is about 120 folks, uh, of those folks, we had like 32, 33% reporting 4 or more ACEs. And so that tells you there, I mean, intuitively, I think we know people that come into the helping profession may have had their own adversities and traumas, but here was the numbers like right in front of us. We're like, now we're asking folks to do the work at a much more human level, a deeper level than just here's another referral, here's another number, those types of things. But we really need you to get human, really need you to get into this, to this, next level of the work. We knew we had to take care of our staff then in a different way. And so what were all the supports and things that we could do? And so self-care plans were definitely one of those things. And then, are we sharing that with our coworkers, sharing that with our supervisors, with our inner circles? And then what happens when we're off a little bit? How do we want to be approached? And we started talking about that during initial interviews and folks who were wanting to come into the organization. So people can see and know what your agency is about right from the get-go. So if we're talking about your self-care at your very first interview, we're talking about our vision, values, and principles as an organization, and how that relates to trauma-informed care, how that relates to self-care, all those things. You're starting to let folks know right out of the gate what they'd be getting into with your organization. So that just starts to build, as folks get further along and into your organization, that they continue to get that kind of support, that they continue to kind of get to work within their own why, within their own purpose. And so I think one of the things that COVID has taught us all, or the pandemic, is that we have a choice, and we should, as you mentioned, younger social workers earlier on, like if you're coming into this work, you have a choice of where to go and do this work. And does it fit how you want to do the work, how the work should be done? You take your time and find that agency and that organization that's going to allow you to do the work in an impactful way.
Definitely, definitely. And I can't say that any better. And I know most people, like, graduate, I need to go get a job. I get it. Like, I completely understand. Inflation, right? Like, rent, bills is real. But what, and I want to be mindful when I say this. Some people gonna be mad. Frankly, that's okay. You know, but what good is it for you to go get a job that you know you can't do the most change or do that you don't really care for? Just being straight and being honest. Like, social work is a very wide and vast, field, as well as child welfare. There's many different ways you can enter into child welfare. Like, I know someone that has a geography degree, but is working in some aspect in child welfare, and there's different levels to it, macro, micro, and what have you in child welfare. But too many times people don't take the time to really see where they fit in this change, in the effort. And too many times it's too late. You lose someone that could have done great, could have,
Yeah,
really, been in a space to create change, but they were in the wrong place. So now I'm done with child welfare as the response. Or I'm done with social work, and they really had the heart coming into this, you
right.
know. So I really, if I can say anything to those individuals who are in school and plan to go into the child welfare arena, or is planning to go into social work, give yourself that time. I know it's easier said than done, but give yourself that time to really see where you fit, where you can do the most, change, where your heart is, desiring to be, you know, and stay true to that. Don't settle or cut short, because trust me, there's a, as much as there isn't a huge influx and we're seeing some low numbers with social work and stuff like that, there will be somebody, doing it. Like, there will be somebody doing it. So if you just take a month to just figure yourself out and what you want to do, it's gonna be okay. I promise you, it's gonna be okay. And,
Yeah,
and it's for the better.
and keep in mind, it can be a two-way conversation, a two-way interview. You can ask, what does turnover look like? What is organizational culture like here? Those types of things, because here in Wisconsin, we have 72 counties, and sometimes, people say you're going to have 72 ways of doing things, and so there are some organizations that, are knocking it out of the park, and you'll see that the turnover's not very, there's not a lot of turnover. There's creative programming going on and things like that. And then you have others that you'll see there's lots of turnover and not so great, outcomes and things like that. And so I would say do your homework in terms of like looking where does an organization match up with my own values and purpose. And it's a two-way conversation.
Awesome. I'm going to switch gears for a
Yeah.
little bit. You spoke about working in residential care, doing nonprofit work, but also working, as a director and supervisor in a state capacity. You know, um, I want to kind of get into the aspect. You've seen a lot. You've probably been through a lot, to say the least. Child welfare has evolved, changed for the better or for the worse. And some aspects throughout your time. Um, if you could, just speak about, where do you see things going, and what are some concerns that you have that you would like to uplift, about, our child welfare system, and you can speak directly about your state or nationally, or however,
Yeah, no, that's a great question, and we could probably spend all day talking about this piece for sure. And so I think for me, I talked about trauma-informed care, and that was starting to shape our practice. And so when you put that lens on, then you start to see things in a different way, and you start to
Mhm.
see practice in a different way, and really started to see child welfare through a different lens. You start to, this like what happened to you, but then also like as a system, like what are we doing? Like
Mhm.
the system that we currently have, if we, and I'm going to use some examples. we were in an innovation cohort with friends of ours, friends and colleagues of ours in St. Paul out of Alea Innovations. So Dr. Amelia Frankmeyer, we were part of an innovation group, innovation cohort with a number of organizations from across the country to look at innovating child welfare, like transforming. Like, so if we thought about today, like you and I, Michael, you and I are in charge of this new city that just developed, and we're gonna take care of the children and families there. That's what we're gonna be doing. And so I don't think there's one piece of the current child welfare system that we would say we want to take that over there. We're gonna duplicate that. I don't think there's anything that we want to take over there. And so I think it's this notion of know better, do better. And so we know so much more about brain science, we know so much more about relationships, connections, all of those different things, that this current system was set up through a much more punitive stance, through a much more, well, it's created to do what it's doing. And that's like tearing families apart, you know? And so I think what we were looking at is like, how do you transform this? And it's not about like tweaking. It's not about saying change this statute or things like that. It's about transforming the whole system and saying like, this system here can just go away, and we're going to bring this, we're just going to make this other one, right? And so making this system that we're currently in obsolete, so we can have this system over here that can take care of children and families the way we know they should be taken care of. And that's more prevention based, more upstream, not relying on these deep end services as much as we have. And so when we think about, you know, I've heard more times throughout my career than I can count that, you know, it takes dollars, it takes money and all those types of things. And I will say that there is a ton of money in the system right now. It's just being put in the wrong places. And so we've developed this huge industry around child welfare. And I think that's our biggest barrier, is we've got this huge industry set up around child welfare to support a system that was, you know, created to help keep families separated, help keep children removed. And so, you know, just in the provocative side of things, like, you know, thinking about foster care, thinking about shelter care, group homes, you know, those types of things. Those are all set up to, you know, what do they need? They need children in those beds. They need, you know, children to keep them running. And so it perpetuates the system. And so what if, you know, what if we could take all that time, talent, and resource that's out there in those different industries, those different resources, and could commit those to keeping children and families together in their communities. So take all those dollars that are being spent out there in those, just in those few places that I just mentioned, and we bring that back to families, back to community. I just wonder how that would look, you know, how that would, well, you know, help families stay together. And so it takes a mindset shift for one, but it can't just be like human services, social services, or the child protection or the child welfare system. It has to be everybody, because if we start changing things here, that impacts law enforcement, that impacts schools, that impacts courts. And so we can do those changes internally with child welfare and say we need to do things differently in the system, we need to do things differently in my organization, but it has to go beyond our walls, it has to go beyond our system, it has to, you know, be this larger system movement. And I think there's lots of conversation about that going on at local levels, at regional levels, at the federal level. But I think we're just scratching the surface on transformation and where things should be going and where they need to go.
Definitely. One of the biggest things that I get out of that is removing the dollar sign and bringing back the humanity.
Yes. Yes.
That's the biggest thing. Like that's the and I can't put it any simpler, that we have strayed so far away as a system built on systems, built on systems, built on systems, you know, from the human aspect of things, the moral standing of things. I've worked for residentials, I've worked for juvenile facilities, I've worked for agencies, in the aspect of mental health and social work and different things like that. And it's, I like to say that these agencies and these organizations, are doing great and they
Yeah.
strides, but
Yeah.
the holding point, the holding point to it goes back to the dollar, goes back to, well, if we ain't got no, this and that and third, then we can't, do this. And I'm like, there
Well,
has to be a better way. There needs to be a better way, because I really don't believe as we continue to hurt the next generation, we continue to persecute. I feel like, through our systems, it's going to further, um, it's going to further damage those generations,
for sure.
and we're seeing less and less people come out of foster care each and every year successfully, and I was just having a conversation earlier today about how many people that come out of foster care actually, make it to middle class,
Yeah, exactly.
actually see equity, and not struggling, you know. How many
Yeah.
people who get on assistance get completely off assistance and never need it again,
Right.
you know?
You're hitting right on.
How many people go through our education system and say, like, I had a wonderful experience in high school, in public high school, wonderful experience. Like, how many people go through our medical system and be like, I was treated fairly. I didn't face any racial or, different kind of discrimination because I couldn't afford such and such.
Yeah,
You know,
I think you're exactly right. I think you're exactly right. And so how do we get there? Because like the system as we know it right now, like any of those things that I mentioned, if you want to look at like success rates and what does success look like? There's not a lot of positive outcome data, long-term outcome data. In fact, I know Leah had done um, some research on some of these pieces, and so like if you've had more than one case manager, more than one social worker, and time, if you're placed out of home, out of your parental home, out of your caregiver home, and it's taken longer than a year, and you've had more than one social worker, which that's probably going to be the case more times than not, that you're going to have multiple workers, which then causes you to be out of home for longer. I think with a successful case, like if you did one social worker, reunification happens within a year. I think the studies showed that we're still losing $6, $6 for every $10 spent. And so that's still not a great deal. And so and I think it's like almost $8 or $9 in every $10 spent when we don't do it right, which the system usually doesn't get it right. And so you wouldn't be able to go to a board or to a company or to somebody and say, hey, here's this program, and for every dollar that you give me, I'm going to lose money on it. That's usually not a good selling point, and that's the current system that we have right now. And so the reason why it's a losing cause is because of those things that you just mentioned. So if I'm in care or in this system, and you haven't given me any of these things to be successful when I'm done with you, where am I going? What am I doing? And that's usually those outcomes have community impact, whether that's, you know, low graduation rate, which then means I can't get a job or get a great job, those types of things are going to keep me oppressed, to keep me in this place of survival instead of thriving. And so I think, the system has a place where we can change that game and make this a thriving system and not a surviving system for kids and families that need us.
definitely. And these are conversations that have been happening for years. These are things that people continue to bring up, and it's not simple, and I don't want to take away from the fact that, unfortunately, with some of these changes that mean that we're going to have to re-envision what child welfare look like, what our education system look like, and trickling down to other, because everything is affected together. Like everything is, and unfortunately, that's gonna, with that, that's gonna be closing of certain things where there's gonna be less need for certain things. When you truly, and I don't know if I'm gonna make somebody mad with this, but when you truly put family first, truly put your all to preserving and prevention and keeping families together by every means, like really truly supporting those individuals, those young parents, those, what have you. Granted, you're still going to have those cases where you have to make a removal. We have those. But, on the scale of those extreme cases of removal, the numbers will be
Correct.
substantially lower if we truly stop removing kids because of poverty,
Yes.
just being real, and calling it neglect. If we assist that family, that young parent, and what have you, to be able to gain equity and resource and be able to get an education or a certificate or what have you, to sustain stability for their children, if substance abuse is and I don't know anyone who became addicted to a substance or anything like that. That was just like one day I want to do drugs. I don't know anyone that happened to, and I think about mental health. I think about side effects to stress and stressors of life that lead people to these certain pathways, prison, substance use, suicide, and all these different things. Side effects of a deeper rooted problem. And if we truly put the people first, what could that look like? And that means that, maybe we may not need residentials, there's countries that don't even have
Right.
like, don't have residents, they don't have all this. Like you just go to cousin Mike's house,
You're right.
you
Right.
know,
Yeah. Yeah.
it's really crazy, when I think about that. Like there's places where this is like they don't even do all this. Like, what are you talking about? And they're looking at us like we crazy when we
I
say this
know.
is what we got going on over here. So there is a future that could be better, but I challenge you guys that are listening, that are in positions of power and the positions for change, and even those who aren't, to just continue the conversation on what would it look like to truly put people first. We all are a part of this big village called America, and if we all do our part to take care of one another, what will we look like as a nation?
Yeah, I think you're right on, Michael. And I think it's this mindset shift. It's getting away from kind of what we know and shifting over to this new way of thinking and being, oh, like understanding families know best and families can take care of themselves. And like we don't need to have some of these intense government interventions, like I think there is a pathway through prevention that is can be much more successful and have a much better trajectory for children and families in our community.
Definitely. And then, another point I want to highlight on that, and then, just kind of transition, is, you have those folks that was like, well, what about, people committing crimes and doing all this other stuff? What about, juvenile delinquents and all this other stuff? Well, big thing is, I was a juvenile delinquent at some point in my time. I've committed a crime. I've been in juvenile. I've been in jail. Look where I am. You know, but to say the least of that is, um, I read a paper years back. And I'm pretty sure, with how today has gone, these numbers are probably totally different now. But um, and it talked about majority of people on death row in California has had an encounter with CPS or should have been in foster care or had an encounter with CPS. And I think about, you know, how true is that throughout each and every state, to our people that are incarcerated, what have you. If someone would have stepped in and been like, hey, I'm not here to judge, I'm not here to do whatever, but I would love to help you become a better parent. I would love to help you support your child. I would
Yeah.
love to help you just make it through life. As a juvenile, I think about sitting in my cell, counting the bricks on a thin, very thin pallet with a huge concrete pad and a steel toilet sink thing. And I think back to that while I do this work now and be like, how was that ever going to help me be better?
Right.
If it wasn't for something within me that the universe stuck in my mind as a thought to be like, hey, Michael, pick up a book, nobody's coming to help you. You got to help yourself, and stuff like that. And too many people are there trying to swim and they have never been taught to swim,
Mhm.
and they're
Right.
drowning within themselves because no one is reaching out to help them. There's more gaps in our system. And there's more disparities within our data,
Right.
than there
And
is, better and great outcomes,
and people
so
and people on the shore just saying swim. You just need to swim. Like
right. I would if I could,
right,
so
right.
I just wanted to highlight that point, how important and how monumental just one person helping one other person
Yeah.
can be the difference, you know.
One or two genuine connections.
Definitely, definitely. um you spoke about your organization and what you do now. If you can tell me a little bit more in depth, about the work and what you guys got going on.
Yeah. So now my whole hope is to be able to work with leaders and organizations to do just what we're talking about. And so felt like the work that we are doing, the last county I was at, Wapaka County, I felt like we were able to take the work kind of through the weeds, like this trauma informed approach, this new way of looking at child welfare, at work in general, this human element to the work. Um, Felt like we were able to knock the weeds down quite a ways to let folks know like it can be done and it can be done successfully, and here are all the things. And there are some red flags to pay attention to along the way. And so my hope is to be able to work with leaders, organizations to say it can be done. Here are some of the things, my lessons learned. Here are some of the things to be taken a look at and get ready for, so you can take this torch and take it even further down the road. You don't have to do all the things, repeat all the same mistakes and those types of things, but take what we learned, take the positives and go. And so working with health and human service organizations for sure, I can walk into both, government run organizations along those lines, nonprofits, community organizations, just to talk about like one, developing an environment and a culture that's ready for change, that's resilient and ready for change, and help support their staff so that we can do things in a different way. And so, we call ourselves a boutique consulting firm because it's myself and my co-partner Brooke Senna. And so boutique meaning small and customizable. And so there are core things that we can work on, but then be really flexible to meet the needs of organizations. And with the work that I had done in my past, I've really well connected to folks around the country. So we have connections to partners that can expand our bandwidth, so we can work with organizations of all different kinds of sizes. And so, we have a little bit of a footprint here in Wisconsin based on just the work that I've done here, working with organizations in Arizona, North Carolina, soon to be working in Kentucky. We have some presence in Tennessee with a partner of ours there, Becky Haas. And in Florida, we worked with a parent group there with our friend Corey Best. And so ready to work and help organizations and cultures, organizations and leaders with their cultures so that they can take on this important work and really help the folks coming through their front door.
Definitely, definitely. You know, it's really I can't speak to how important it is to have people with your experience, you know, preaching, and trying to teach, you know, this message, of, it is important, but nonetheless, it is possible to be transformative and to make those efforts,
Yeah,
and
and
that's something that go ahead.
so we do that through a variety of workshops. We do different webinars, presentations, things along those lines. And then we also do professional and organizational coaching, mentoring, and then just really want to be able to work with and support leaders. And so we have a variety of things. We have some set presentations and workshops that we can provide, but then also adapt to what the organization's needs may be. And so you just hit up bluecollarconsulting.net and connect with us, and we can be happy to have conversation with your organizations if anybody's listening in.
Thank you for that. Yeah, I'm, I can't, say how appreciative I am because, I know, from our conversation, and watching some of the work that you've been doing and what have you, how important to have someone with experience, seeing the other side of things, but also trying to be a part of the change and the effort in really being transformative and passing that message on and taking that to other organizations because it doesn't stop with you. It doesn't stop with the webinar. It doesn't stop with the
Right,
mentorship because
right,
what eventually ends up happening is they have, called you in to help and now they're passing that message to their staff and their staff is passing that message on if they leave and go somewhere else, and stuff like that.
exactly.
So it's creating that.
Contagious.
Yes, definitely the word contagious, you know. Um, so I truly love that. Um, it's one other piece I wanted to, bring up and uplift, as we get closer to ending this out. Um, there's been a lot of shifts and child welfare and a lot of different reforms happening in different states and you know everything but there's been a big highlight in trying to bring lived experience to the table and not just lived experience you for young adults that have been through these systems but parents, birth parents, you know um as someone with your experience and what have you, how important is this that organizations partner with the families and the people who have experienced that to continue to be better?
I think I think it's incredibly important. And if I could go back in time, I would have done more of that with my experience in Wapaka County, because I think that's a piece that we were just starting to get our heads wrapped around or get involved with. And I think intuitively we know that, and we had spent too much time, I think maybe internally getting our house in order, and all the time we probably should have had lived experience helping us get that house in order as well. And so we've had the opportunity to work with parent group in Florida with our friend Corey Best, and working with some parents there who have lived experience who are looking to transform the system there. And what a powerful venue, powerful voices to bring to the table when you can hear from their own experience. And for us, from the in the work in the like in my role as a director, to be able to hear from folks who are impacted by my organization, to say like, yeah, that notion is great, but here's what really happens when you apply that kind of practice, or here's would be even more helpful. And so we talked a bit with that group. It just resonates in my brain. We talked a lot about self-care in one of our uh, uh, with one of our workshops with them. And to one of your points earlier on, Michael, like nobody had ever asked, like, how are they doing? Like, how's your self-care? Are you taking care of yourself? And one of the mothers had said, like, somewhere along the line, we weren't taking care of ourselves, and that's what got us into where we're at. And so, just this human question of how are you doing? How are you taking care of yourself? That's literally a question that folks in that group, and I'm sure that that's not unique. I'm sure it's across systems. Um, that's just the place we haven't gone, you know. And so, what do, I just keep getting these questions in my head about like, what are we doing? What are we doing as a system right now, and how do we make it more human? And I think it is getting the voice of lived experience, those that have experienced it or are experiencing the system, and help us shape and transform how the system should really be. We're really good at making plans in our offices and then sending them off for somebody to do with no investment or no say, versus um, getting that voice right at the front and all the way through about what's going to be most impactful, and there'll be more investment into the success of the plan.
Definitely. Um, any last comments you would like to leave here?
Mike, I just want to say thank you. Thank you for what you're doing with your podcast here, and raising up the issues and letting folks be able to speak openly and freely here. It's been a pleasure getting to know you, and I think I just want it's this message of bringing human into the workplace, and that certainly resonates in human services, but I think it goes across sectors and industries for sure. But I think it's really about taking care of the people that take care of the people for me when I talk to leaders and organizations. And so I want to make sure that, that organizations are healthy and thriving, because I know when that happens, folks that need us the most are going to get the best that we have to offer, versus a status quo system that is not doing any good for anybody at the moment.
Awesome, awesome. Thank you for being on. It's truly a privilege to have you on, and such an honor, such a wealth of knowledge. You guys heard it here, episode 10, and I'm going to continue to have these conversations, so I know there's some things that were mentioned in here today that can be potentially triggering or what have you, but also we talked about mental health and transformative change, so make sure if you've listened to this episode and something has been triggering to you or your experience or what have you, you take some time to debrief, do some mindfulness exercise. So I just take care of your self-care, as we mentioned, and definitely, do your best, but this has been Resilient Voices and Beyond. Thank you.